Okay, let me try to unpack this. So the Trump administration just finalized a rule banning Medicaid funds from covering gender-affirming care for kids under 18. On the surface, it sounds like a policy decision, but when you dig deeper, it's a masterclass in political theater wrapped in a moral panic. Let's break this down, because the real story here isn't about healthcare. It's about control, fear, and the weaponization of parental anxiety. First, the hook. Imagine a government deciding what medical treatments your child can access based on ideology, not science. That's the reality this rule creates. And here's what's wild. Trump's framing it as protecting kids from barbaric surgeries. But does anyone actually think Medicaid is paying for irreversible procedures for minors en masse? The medical community overwhelmingly supports a cautious, multidisciplinary approach for transgender youth. So why the sudden focus on this? In my opinion, this isn't about kids. It's about rallying a base by manufacturing a crisis that's more myth than reality. Let's talk about the mechanics. By cutting federal Medicaid funds for this care, they're forcing states to choose. Either cover these services entirely with state money, which most can't afford, or let kids fall through the cracks. This is a classic divide and conquer move. It's fiscal coercion masked as moral responsibility. And the 6-month tapering off period? That's not compassion, it's a PR buffer. What this really suggests is a deliberate attempt to make gender-affirming care financially inaccessible for low-income families. How messed up is it that healthcare becomes a privilege you can only access if you've got cash? Now, Trump's claim that parents are being kept in the dark about their kids' transitions? That's a narrative built on isolated anecdotes, not data. What many people don't realize is that ethical providers require parental involvement for minors. This isn't some shadowy conspiracy. It's structured, documented care. By painting it as coercive, they're not protecting families. They're eroding trust between parents, doctors, and vulnerable kids. And the mental health carve-out? That loophole is fascinating because it's both cynical and telling. They'll fund the therapy sessions that might lead a kid to question their gender identity, but not the medical care that follows. It's like paying for someone to explore their identity, then slamming the door shut when they need support. The broader implication here: this isn't just about Medicaid. This is a blueprint for how ideological agendas get baked into policy. When you start cherry-picking which medical treatments are deserving of funding, you open a Pandora's box. What's next? Denying coverage for certain religions' healthcare needs. Cutting funds for autism therapies deemed too progressive? This raises a deeper question. Who decides what counts as legitimate suffering in America? And why are we letting politicians with zero medical expertise make those calls? Here's the thing. Policies like this always hit marginalized communities hardest. Low-income trans kids aren't suddenly going to stop existing. They'll just suffer in silence, denied care that could literally save their lives. And while Trump's celebrating this as a win on Truth Social, somewhere a family scrambling to find thousands of dollars for treatments their state Medicaid used to cover. That's the hidden cost here, not just financial, but human. So I'll leave you with this. When did compassion become conditional on political ideology? And more importantly, what does this say about a system where healthcare access depends on which party holds power?